Welcome to Conceive the Podcast, your resource for all things fertility, women's health and pregnancy, with your hosts, Jaya, Chinese medicine practitioner and Director of Natural Fertility Geelong, and me, Libby Morgan, Practice Manager and Jaya's friend. In our final episode for Endometriosis Awareness Month, we had a great chat with acupuncturist Naomi Jankowski. Naomi has recently joined our team at Natural Fertility Geelong after making the move from the city to the coast. In this episode, Naomi talks about her passion for using acupuncture to help women with endometriosis and other pelvic pain conditions. Welcome, Naomi, to the podcast. Let's get straight into it.
Awesome. Thanks for having me.
Can you just tell us a bit about your background before we get into the nitty-gritty about acupuncture and pain?
Yeah, absolutely. I have to make a confession. I had to ask Jaya what that question was going to mean before we started the podcast.
How much detail do you go into when you talk about yourself?
What are you going to ask me? So just keeping it relevant, a little bit about myself professionally. I graduated from the Southern School of Natural Therapies in 2010. I already had some background in being interested in pelvic pain conditions. I had suspected endometriosis myself. And at the time when I was finishing up studying, I started doing some time at a practitioner called Stephen Clavy's clinic in the city. And I started being a student there and then also started dispensing herbs at his clinic. He's predominantly a herbalist.
And on a side note, he's a really famous Chinese medicine practitioner.
Yeah,
in the
he is.
gynae world as well, especially with herbs.
Yeah, especially with herbs and also especially actually in the endometriosis community. So quite formative there with his thinking and with his use of herbs to treat endo. And I guess that just started getting me very interested in the general gynecology world and how I could work with that with Chinese medicine down the track. I started practicing at his clinic as well. About 4 years ago, I was approached by Dr. Claire Myers, who runs Elgin House Clinic in Carlton, and she is an excellent doctor. She's a great gynecologist, also an excellent surgeon. For those who know her, she has a really good reputation in the endo world. And she asked me if I would start to do some acupuncture at her clinic. She was building kind of this general women's health space where she could create, I guess, more of a holistic background for her endo patients where they could see her or one of the other gynecologists, but also have a bit of a one-stop shop for all other things that could help endo, like pelvic physio, psychologists, sexologists, etc.
Sounds like an amazing clinic from what you've told me.
It was. It is. It still continues to be.
What a great setup she's created.
Yeah, she's created a really great space. And I think that type of environment, we really just need to be seeing more and more of that.
And why the move to the coast?
COVID, partially.
Yeah.
And also I really wanted to move for quite a few years anyway. I started surfing and that changed things for me. So I was really digging at my partner, asking him if we could move for a little while. And then COVID hit and that just really changed things for us substantially. COVID just knocked down quite a few businesses and my partner's was included. So we made the move to the coast just kind of wanting to start again a little bit.
People have done something similar.
Yeah, they really have.
And it's created new opportunities in some way.
Yeah, quite amazing.
And very lucky for us because now you're working with us and you're also working at Torquay Chinese Medicine. So
yes.
Can access you in
such a good change.
Different places.
Yeah, and it's really good. It's really unusual for me, I have to say, because I've been practicing in Melbourne for about 10 years and it's so strange to just uproot. I feel like I'm kind of starting again in some ways in terms of patients. It's really unusual. You know, you've been seeing patients for years and years. Yeah, it is, but it's also really exciting.
Okay, so let's talk about pelvic pain and endo. But for those who don't really know, how does acupuncture work in that scope in that area?
What we're thinking of specifically with endo is that endo is a very complex disease. We know that now endometriosis isn't just about the actual endometriosis adhesions that are located in the pelvis. It's not necessarily just a case of having to work in or surgically remove those lesions. We need to treat endo as a much broader disease. And I think what acupuncture does so well is that it sees each woman or each person as a case-by-case basis, and we're working with that person holistically. So, for example, if I see an endo patient, then I'm going to be asking them detailed questions about how endo presents for them. We're going to be looking at things like, are they getting bloated? How are their other digestive symptoms? Digestive symptoms are a huge component of endometriosis.
Massive.
If we can improve some of those digestive symptoms for that patient, if we can improve their energy, if we can work on things like getting that patient sleeping better, waking up more refreshed, they're going to be a lot more resilient, and they're going to be able to work in a lot better just in their own body to be more resilient to that endo. But we're also really targeting their pain. And I suppose that's my big love now, working with acupuncture and pelvic pain conditions. I have to say it just works really, really well. So even though I'm not touching those actual adhesions, I'm not doing anything surgically clearly, we can still really get a great result working in with a lot of patients' pelvic pain. Patients will then ask the question as to, I suppose, how that works. How are we getting that decrease in their pain response? And they're quite surprised to hear that when I apply acupuncture for them, I won't actually be doing any needles around their pelvis. We're only using distal needles. So we're only using generally points on the arms and legs, possibly also a point on the head if needed for that patient. What we're doing is trying to calm this pain response that that patient might be having. What we're seeing with all of this new research that's coming out is that a lot of endo patients have a heightened pain response coming from their brain. Not to say that these patients have a decreased pain threshold. It's a really different system than that. It just means that somewhere in their brain, there's this firing message that's just constantly saying that they're in pain. And what we can do quite well with the acupuncture is we can calm that response, and we can start to send a signal to the brain, telling it to ease that signal. And that's going to work in really well for a lot of patients' pelvic pain.
All comes back to the brain, doesn't it?
It does. Yeah, absolutely. And, it really comes back to how acupuncture ties into the nervous system and easing a lot of those pain responses.
And I guess for people who haven't had acupuncture, they don't realize how relaxing the process actually is.
Absolutely. Yeah, I think patients' first session, it's often a little bit scary. They're a bit apprehensive. They have a lot of questions, which is absolutely understandable. And then usually most people by the second session, they're feeling pretty relaxed. They know what to expect. They feel comfortable with us. Yeah, it's quite a nice process.
I think I'm quite amazed about the way you treat as well, is that you use very few needles.
Really few needles, which most people really like.
It's great.
Yeah. So generally in a session, I like to tell my patients that maybe you can expect about 6 or fewer needles. When people are booking in a session of acupuncture, there's this conception that they might have like 20 or 30 needles and it's going to feel really intense and be painful. And it's quite nice when we can unwind some of those preconceptions. It's also quite nice that we can get pretty good results for people with just 4, 5, maybe 6 needles.
You just mentioned distal.
When we're saying distal, we're just meaning away from the site of pain or away from the site of disease. In the case of my practice, that usually involves points mostly on the arms and the legs instead of being mostly points on the trunk. So some acupuncturists do needle the pelvis. Just for me, in my practice with the way I work, I don't tend to needle the pelvis. So we can still get those same results.
And because acupuncture is so holistic as well, you don't need diagnosis of endo. It still works with undiagnosed pain conditions through the pelvis.
Absolutely. Because we kind of have a different framework of thinking. So when a patient does have a Western diagnosis, that type of information is really key for me moving forwards. But at the same time, if we don't have that, it's almost like I would work with those patients fairly similarly because we're looking for so many different things and we are looking to work with that person holistically.
And we ask them lots of questions.
Yeah.
The management of endo is changing now. Even from a Western medicine perspective, we know a lot more about the disease now. I think we've kind of touched on this a little bit. Being a part of a good team is really important in the management. And
Mm,
acupuncture plays a role in that, but also your team talking together as well
absolutely.
can create better outcomes for your patients.
Yeah, that's such a good thing to unpack. I think having the right gynecologist for you is really essential. And ideally, if you need a surgical process like a laparoscopy done, if that doctor is also an amazing surgeon, that's going to make a really big difference for you. We also have that broader view of what that team might entail. And that is just so dependent. It's really a case by case basis. For example, at Elgin House, the doctors were really quite good at being aware of what each allied health practitioner could offer and suggesting to each patient who they might best be suited.
And would this be a conversation they were having really early on?
Yeah, in that initial session. So, quite often, for example, a patient might get referred to me and they might also get referred to a pelvic physio if the gynecologist suspected that there was any type of pelvic floor dysfunction, for example, tightness in the muscles there. Or maybe if that patient has a history of some kind of abuse or trauma, unfortunately, that's affecting their pain, then they might refer instead or as well to a psychologist, a sexologist, making sure that they kind of land with the right resources to suit their particular needs.
Because not everyone needs a laparoscopy,
Mm,
but there's definitely people that need it and it's better for their health to get it done. That coming back to that team, for the
mm,
people that have the lap, they're in a lot of pain, but they go in there and it's really superficial endometriosis. It's not a correlation of pain versus what stage of endo you have. That sometimes those people just feel a bit lost. They don't know what the next steps are
yeah,
because there was
yeah.
a really big expectation that I was going to be full of endo. Now what?
Yes, absolutely. When you're discussing that, what comes to my mind is you can kind of have a bit of a read yourself about this. If you even just Google The Guardian endometriosis and 2021, there's an excellent, really easy to read article that comes up. And it talks about how we can categorize endometriosis in three ways. About 80% of women with endo have superficial peritoneal endometriosis. You can also have endometrioma, or you can have deep infiltrating endometriosis. For the 80% of women who have the superficial form of the disease, they're actually suggesting in that research that laparoscopic surgery might not be the best treatment option. And I suppose what we need to start doing moving forwards is working out where each woman sits in those three categories and then triaging them appropriately. So, laparoscopic surgery absolutely has its place and absolutely is an excellent treatment method for certain types of endometriosis. But we need to start considering a broader range of management options as well.
Outside of the painkillers.
Yeah, absolutely. When Dr. Claire Myers, talked to her endo patients when she first sees them, considering management options of endo, there are three categories of management. The first is non medical, the second is medical, and the third is surgical. And she puts a huge amount of emphasis on non medical. Come back to that in a sec. So, medical basically involves all of the drug portfolio that you can utilize that the gynecologists can offer. So, things like the contraceptive pill, Mirena, various painkillers, etc. And then surgical, obviously, mostly talking about laparoscopic surgery. She comes back a lot to this non medical component and says to the patient, what are you doing for your health? How is your sleep? Are you stressed? What are you doing for stress management? How's your diet? Are you exercising? And that to me, first of all, that's such a sign of an amazing doctor who's actually,
Absolutely.
isn't it? You know, but it's also, it's just common sense because you can't take all of these drugs and have this surgery if you're not doing the other things in your life, right? You need to also be investing generally in your health. Things like stress management are huge as well, you know, and they're big things for a lot of people these days.
And it's finding what works for you.
Yeah,
Exercise,
absolutely.
acupuncture.
Yep. So, in that non medical part of the conversation, she would then discuss things like acupuncture, pelvic physio, psychology, also just giving the patients really general exercise, diet advice. But really general, she'd be saying to her patients, I want you to do 5 times a week, 30 minutes of exercise where your heart rate is really coming up.
Where we know that exercise is so great for pain.
Yeah. Yeah. But just keeping it really simple. And diet wise, she would say, don't get too into the nitty gritty stuff because you're just going to go down this rabbit hole. Let's just keep it simple. We all know that we need a good diet with less processed foods and as much fruit and veg as you can have.
Without getting to the point where the diet then becomes stress.
Absolutely. There's so much conflicting stuff and so many things about gluten and dairy. Yeah, which are all, when you have appropriate guidance, can be really helpful. But then some people find that quite overwhelming. So just depending on what works for that individual as well.
So when people come to see you, is there a specific time in the month that it's better to see you?
Yeah, definitely. I usually say when someone is booking in for their first session, don't stress too much about where it is in your cycle because we've got so much background to cover. The acupuncture that I can apply on that day can work on some of those background issues as well. So I'm not too stressed for that first session. But then following on from that, I do really try to tie in as much as possible with the patient's particular pain windows or menstrual cycle. So they're getting as much benefit as they can with the acupuncture. For example, generally, I'd like to see the patient 1 to 3 days before their pain window comes on. And in that time, we're doing prevention work to try to ease the pain that generally they would expect would be coming. And that's when we'll get the best results, the best immediate results for them.
This is what I'm so amazed about the style of acupuncture you do. So people probably don't realize that I spent the whole day with you yesterday at a seminar that you were teaching. So I felt like I learned a lot. The pain reduces significantly in one treatment.
Yeah,
so that's
in
why,
some circumstances.
in some circumstances,
yeah.
that's why you're doing it so close to a pain window.
Absolutely. Yeah. So I guess when I first started implementing this kind of style of acupuncture, quite specifically for pelvic pain, I would try to time it during the patient's pain window. And now what I've found, because we could get quite quick results for them. And initially that was really helpful for me because I was seeing this reduction of the pain while I was working with the patient. And now what I'm finding can give better results for the patient, because we're completely potentially avoiding their pain window, is if I can see them a little bit before and we're just trying to really work on preventing that whole pain window.
Probably people don't realize as well is it's not just the pain you're working on, but also if you've got very heavy bleeding or
Absolutely.
your periods are too light.
Yeah.
There's a lot of things that acupuncture may influence or can influence.
Yeah, definitely. And a lot of patients kind of ask this question of like, is that treatment that you're giving me on this day, is it just going to prevent the pain for that next cycle or does it have a bigger picture? And it absolutely does. It's not like I'm giving you a handful of Panadol. We're teaching your brain how to have less of that heightened pain response. And each time I see you for acupuncture, we give the brain more and more of that signal of you don't need to have this pain message. Let's calm that response down. So the more of those acupuncture treatments you have, the less of that heightened pain response you'll have. And then also exactly what you said, Jaya, all of those other things that we're working with as well. So digestively, we'll be having an impact. We'll be having an impact on things like your sleep, your energy. PMS is massive, absolutely. Especially, just before a period, we can really work in with that. Even things like headaches that come on premenstrually as well. Yeah.
And it really is beneficial to have more than one treatment.
Yes.
Acupuncture doesn't work that way.
Yeah.
You're going to get better results
when
you build up each time.
Yeah. It's almost like you should see some result with the first session, but definitely give it more than one shot. It is really unfortunate when people kind of just give it one crack and they think they should be completely healed from that or fixed. Yeah.
But I think if people are getting a reduction in their pain, even in that first session, they're on board.
Yeah.
They can see the benefits straight up. Where sometimes when we're working with fertility, it can be a long time before we really see the changes.
Absolutely.
So it can be a bit of a long
That's actually kind of why I started stepping away from work in fertility, because when I was working at Stephen Clavy's, he's excellent with endo, but also really renowned as a fertility specialist with herbal medicine. And I have to say, I think for me, I loved seeing that more instantaneous result for a patient. And there's something in me that is a little bit impatient. And
aren't we all?
Aren't we all? You just want to know, and not necessarily impatient, but I just wanted to have my hand on this idea of, are we definitely making progress here, and wanting to see that quite quickly.
I can see how that is really appealing.
Yeah, it's huge. Quite gratifying,
especially for your personality type, Jaya.
Talk about impatience.
Definitely
This
see
is
that
born
being.
impatient.
Another question going on from how you treat. I know with the fertility clients, we're often seeing them weekly. Is it a similar system when you're working with pain?
Good question. It really is a case-by-case basis. For patients with pretty extreme high-end sorts of pain, where they're having pain every day, regardless of their cycle, I would absolutely like to and really need to see them once a week. And then once they start to get results and their pain becomes more manageable, and we also start to see it having more cycle relevance. So potentially they stop having pain every day, then have pain in their ovulation window and also their menstrual window. That's when we can start to bring the treatments down, and maybe I could see them every second week just before ovulation if they're having ovulation pain, and just before the period to target that period pain as well. If they're only getting pain once a month, then it's a different story. I might see them once a fortnight at the beginning, and then just once a month just before the period as a more long-term approach as well. And I do see a lot of patients who initially were seeing me perhaps weekly, and then they drop to fortnightly, and then I start to see them monthly. And they'll kind of just come in once a month for this top-up session, timed really well just before their period, and it works fantastically for them. Kind of like your once a month osteo or once a month chiro session.
Maintenance.
Yep, it's more than that too, because you're going to still get this really targeted pain prevention for that cycle. So I do encourage patients to make sure they book in with me just before that period.
And it's not just that you'll get the same treatment each month too, because things can change in your body and you'll take that into consideration. And it's a really individualized treatment. Depending on what you've got going on at the time, you get different points.
Yeah, absolutely. We were kind of covering that in the seminar yesterday.
Yeah.
I was saying to the attendees, you can't have this idea in your mind that this one approach worked for this particular patient really well the first 2 times, and that means that you can just use that for every treatment after that. It's really not like that. You need to pay attention and see what is changing for that individual as you continue to work with them. And their cycle might change, their general health might change.
Stress might change.
Absolutely.
Yeah, it's a really good thing to remember.
And Naomi, besides endometriosis, people can come in for other pelvic pain conditions?
Yeah, absolutely. So broader spectrum of pelvic pain as well. So I do work in with also undiagnosed pelvic pain. So if you're just having things like painful periods, that's definitely something that we can work with. Conditions like adenomyosis.
What's that?
So for those who don't know, that's where the cells that normally form the lining of the uterus grow inside the muscle wall of the uterus. And then what we're seeing for a lot of those adeno patients, pelvic pain is a really predominant feature, but also heavy bleeds tends to be a common complaint.
Really tricky to diagnose as well.
Very tricky to diagnose.
So it's different to endometriosis.
Yeah, women with endo are more likely to have adenomyosis and vice versa, but they are mutually exclusive.
Kind of related, but not.
Yeah, yep. So it's almost like you're seeing the tissue that you do with endometriosis, but actually inside the wall of the uterus. Whereas in endometriosis, that tissue, that lining is then kind of spread all through the pelvic cavity. So in areas like ovaries, the remainder of the pelvis, bowel, and also working in with external genital conditions like vaginismus and vulvodynia, where there can be pain or a burning sensation, itching, discomfort in the external genitals, can also stop women, for example, having intercourse or feeling like any type of penetration is comfortable. I do also work in with those external genital complaints.
And that's working again with the needles in a distal
Yeah,
fashion?
good question. Yeah. So
Not located in
again,
the site?
no pelvic needles are used. We're only using points for vaginismus and vulvodynia, also just on arms and legs, perhaps also one on the top of the head if we need it. But still using that same idea of distal acupuncture, still using some of those same ideas like we were discussing with the endo patients, where we're also trying to calm that pain response. And then doing with the acupuncture some kind of more direct work to help to soften the muscles in the pelvic floor, even though we're not needling the pelvis. I do have to say, with most of my vaginismus vulvodynia patients, I do also refer to pelvic physio, and I find that combination of treatment works really, really well.
How nice for them to get a treatment where you're not going near the area.
Yeah, it's a bit of a relief, I think. I mean, pelvic physio is so fantastic.
Oh, it's amazing.
Yeah, it's amazing, and it's really crucial for these patients. They need to learn how to loosen these muscles that they've been taught to just keep in this tightened position for years and years.
And people can often be really unaware of the condition itself, or, even some doctors. So getting that diagnosis and just feeling like get help with it.
And again, that kind of does come down to having a really good team. So having a team that can, first of all, diagnose you correctly and then refer you appropriately to the right person that patient needs.
I can just imagine how debilitating it would be to have a condition like that.
Awful. And so many patients do say that it takes them years to find that diagnosis, to get the doctor who actually knows how to work with them.
And we're lucky in Geelong that we have a number of great pelvic physios.
We have some great women's health physios.
How exciting. I can't wait to make all these new referral networks.
Thank you so much for coming today and talking about what you do.
Oh, it's been really good. Thank you for having me.
Thank you for listening. If you enjoyed today's episode, please share it with a friend, subscribe where you listen, or head to Apple to rate and review. You will find the show notes on our website, conceivethepodcast.com.au, and can follow us on Instagram at conceive_podcast, where you can also leave questions for future episodes.